It is a dark and stormy night. It is eerily silent in between the bolts of thunder until you hear the shrill siren of an ambulance that pierces through the abnormal calm. The paramedics have just taken Maria, mother of two, to the emergency room. The paramedics don't know what is wrong with her, but they see that she is in excruciating pain. She has never felt this way before and is covered in a cold sweat. Maria is a healthy woman and has never visited the ER in her life, nor does she visit the doctor regularly. She has never had surgery before, does no illicit substances, takes no medications, and engages in no risky behaviors. She is a devoted mother to two children and volunteers at the local food bank. She doesn't know it yet, but in 5 hours' time, Maria will die from this sudden, mysterious illness. Just a few moments ago, she was at home playing with her kids and cooking them their favorite chicken parm. She's been having some abdominal discomfort for weeks now. Just little gnaws of pain here and there she chalked up to nothing major. She's also been experiencing a few days of diarrhea and some darker stools, probably period cramps or indigestion, she self-diagnoses. While sharp at times, they always seem to dissipate and disappear into the background. I'll go check it soon, she promises. As a full-time working mom, she rarely has time though. Unfortunately for her, she may have waited too long. The pain gets worse. She tells her kids she is going to go to the bedroom to rest for a few minutes. There, she sits down and gets some momentary relief. It is short-lived though, because in a split second, she experiences a severe and sudden pain in the lower left abdomen that shoots to her left flank region. She has never felt pain like this before, and in a matter of seconds, she is in cold sweats. She feels that she is going to pass out and calls out to her kids. They rush into the room and find their mom on the ground clutching her abdomen, face completely inscrutable. The older 12-year-old knows something is wrong and quickly dials 911. In the ER, she is quickly placed onto a stretcher and changed into a gown. The staff attempts to ask her what is going on, but she is writhing around the stretcher in pain, unable to find a position of comfort. Her eyes are filled with tears, and she mumbles for something to stop the pain. The doctor reviews her medical history in the chart, but it is outdated as the patient hasn't visited any office for the past few years. The one note from a couple years ago reveals a past history of kidney stones and lupus. He presses on her abdomen, and the patient yelps, tenses her abdomen, and yells at him to stop that. He glances at the monitor and sees her vital signs. Her heart rate is in the 70s and her blood pressure is 127/84, all boringly normal. Normal vital signs in a relatively young and healthy woman? The doctor loses a little bit of urgency. How bad could this be? You can already tell he's made up his mind and ready to move on to the next patient. In his mind, there are 3 diagnostic choices. Number 1, a kidney stone, which are indeed incredibly painful and can bring a full-grown man to his knees crying, and in fact does characteristically cause a patient to writhe around in bed like so. Number 2, nothing at all. If the doctor could get $1 for each time he's found nothing after $1 million workup in the ER, he'd already be retired. Number 3, she's faking it, just to score some powerful pain medicine. In fact, the patient the doc just saw previously fit that exact profile. He had apparently lost his prescriptions of opioids his primary care doctor wrote for him to medicate his chronic back pain. You can't blame this doctor's mental heuristics though. You have a couple of different biases at play here. The anchoring bias of a patient who already has a history of kidney stones, and the availability bias of drug-seeking behavior of someone who was obviously looking to score some drugs just a few minutes before. And to add some context, the ER is a harrowing place where society dumps all of their problems. The drunks, the drug addicts, the homeless, the suicidal, the psychotic, and the never-ending parade of healthy people that don't need the emergency care but end up clogging the machine, expecting all their chronic health problems to magically be solved in a few hours. Most ER docs only have a few minutes with each patient because the place is massively understaffed. Each doc often tends to 10 to 15 patients at a time with no capped limit. Your next patient may have a bleed in the brain or a massive heart attack. You can't just ignore him. And after that, there's 5 more waiting to see you, and even more streaming into the waiting room and ambulance bays every hour. So, the doc orders a CT scan of our patient's abdomen and a cocktail of strong IV meds and narcotics for pain and nausea. The patient is wheeled into the CT room. Before they can get her onto the CT table for the scan, she suddenly becomes unresponsive. The nurse accompanying the patient quickly realizes she doesn't have a pulse and starts CPR. The panicking CT tech yells for a cold blue to be called. The overhead system pages out the alert and people start streaming in to help with the situation. How could this healthy 41-year-old suddenly be in cardiac arrest? Why did her heart stop? Why is she now dead? She is quickly wheeled to the advanced resuscitation bay with CPR ongoing. There, the patient miraculously gains consciousness and tries to sit up but still looks incredibly sick. She is pale as a ghost, covered in cold sweat, heart rate thumping in the 130s, and a blood pressure of 70/40. A normal heart rate should be between 60 and 100. A normal blood pressure should be around 120/80. When a person's blood pressure is as low as 70/40, they are in what doctors call a state of shock. It appears that the heart is trying to compensate by pumping more quickly, but is obviously unable to remedy the situation. To simplify, there are a few broad causes for shock or low blood pressure. To name just a few, there's septic shock caused by a massive infection, hemorrhagic shock caused by a massive bleed, cardiogenic shock caused by a problem with the heart, or in other words, a broken pump, obstructive shock caused by something physically blocking the pump from pushing blood forward adequately. This could be a large blood clot in the chest, a collapsed lung, or blood trap around the heart. The doctor isn't sure what the cause is yet, but he quickly gets to work on possible causes. Another IV is placed. Several liters of IV fluids are pumped into her veins. While this is ongoing, the patient initiates special medications that push the heart to work harder and further constricts her blood vessels as a way to increase circulation to her vital organs. A tube is quickly inserted down her trachea, and her breathing is taken over by a ventilator. The doctor then jabs the patient's neck with a large bore needle and pierces her internal jugular vein. Through it, a metal wire is inserted, allowing for a large catheter to be snaked through the jugular all the way down to the heart. In this large bore catheter, bags and bags of blood products, red blood cells, platelets, plasma, they're all brought down from the blood bank and transfused into her bloodstream. Eventually, the doctor gets the situation under control, and the patient's blood pressure stabilizes to a more normal range. The poor patient is now half machine, half woman at this point. There are more wires coming from her and out of her than a tree on Christmas morning. She is literally now the sickest patient in the entire ER and possibly in the entire hospital, and definitively in critical condition. With her life still hanging on a thread and with no answer why in sight, she is brought to the front of the line and immediately wheeled to the CT scanner before she goes into cardiac arrest again. This time, they are able to complete the scan. The doctor pulls it up on the computer while holding his breath and is horrified by what he sees. A 5.8 centimeter ruptured abdominal aortic aneurysm with active extravasation, the medical term that means she is currently actively bleeding from one of the most horrible places to bleed in the body ever. The aorta is the largest blood vessel of the body and is the main central pipe that comes straight out of the heart. When this pipe ruptures, the entire human body's circulation can bleed out in the matter of minutes. The doctor scans the CT images further and sees multiple pools of blood sitting in various locations in her abdomen, already pushing her organs away from where they usually reside. They could pump in 10 blood banks worth of blood into her veins at this point and it wouldn't matter. Like a punctured balloon, all the blood was pushing straight out and filling the abdominal cavity. She needed surgery right now. The vascular surgery team is called and takes her straight to the operating room, or the OR. On the operating table, they open up her abdomen and clamp down on the aorta above the bleed with specialized surgical instruments, effectively tourniqueting and shutting down blood supply to the lower half of her body. New fresh packets of blood are brought and rapidly pumped into circulation to keep her alive while the surgeon attempts to repair the ruptured blood vessel. Despite the continued supply of new blood, the stress of this continual exchange was just too much for her body to bear. Her organs were already too starved of blood to function properly and began shutting down one by one. The acidic, toxic metabolic waste products from these dying organs had built up throughout the body to a critical level and began seriously interfering with the delicate electrochemical balance her heart needed to beat properly. The heart began to convulse out of rhythm and skip a string of beats altogether. A few seconds later, this poor woman's heart had had enough. It quivered to a final standstill and refused to come back to life. This is the true story of a woman who suffered a ruptured aortic aneurysm. This is a diagnosis that is not typically found in her age group and is rare enough that it was published in a case report. The typical demographic for this devastating disease is in older males over the age of 55 with a history of high blood pressure, atherosclerosis, and cigarette smoking. It is believed that the patient's history of lupus was a major risk factor in the development of her disease and can result in the formation of aneurysms as early as 30 years in advance. Lupus is an autoimmune disease which can cause increased inflammation and weakening of the blood vessel wall, resulting in aneurysm formation. It's no joke. Next time you have abdominal pain, think twice about ignoring it. Your life is actually pretty fragile, and you never really can know what will happen. If you like this and want more, please subscribe for more medical cases and stories, just like this one. Until next time, my friends.